involved with the world of TV or sports or radio and all those kinds of things, and I became a bit of a handful. And then, in a way to kind of reconcile my own issues and questions, I ended up going to seminary at Princeton to figure out a lot of things in theology and philosophy of science. Then went to med school, and once I realized that science is a great thing, and then in the context of that became very interested in the interface between larger questions of our being and science and psychiatry. So I love psychiatry. I think the mind is fascinating. And along the way, I began to gather CT scans and lab tests from before and after the spontaneous remission of incurable illness. And that's actually been a really amazing journey for me. If you're on the science side, you call it spontaneous remission or placebo. If you are on the spiritual side, you call it a miracle or spiritual healing. Well, what's fascinating is all of these terms are black boxes, and science has never been used to unpack these black boxes. And so I've kind of been fortunate enough to stumble into an unmapped area in medicine, and talking to people who have recovered from illnesses that we have considered incurable is changed my life, frankly. These people are teaching me a whole lot. People's stories, Mary's stories, people who recover from illnesses that are really difficult have taught me a lot. What's fascinating is, one of the things I've learned is we have a science of disease, but not a science of health. And that, since I believe we've become what we focus on, that's a very telling statement about where we are. I do think that in the evolution of the treatment of disease, we made a good and solid step when illness was taken from the church and established on the foundation of science. It made it more difficult for people to judge themselves, thinking that maybe their illness was a judgment from God or something that reflected a failure at some level. And it also allowed early scientists to begin identifying the signs and symptoms of one disease and distinguishing that from another disease. And I think that was a fantastic step forward, but that's still a science of disease and not a science of health. And so it's fascinating to me that we've never studied the people who got well unexpectedly. You'd think that would make a lot of sense, right? I mean, if you want to know how people get well, we should study the people who get well, and we should study the most extreme examples of that. Well, we haven't done that, ever, in the history of medicine. So, it's been fascinating to me. I had a chance to give a TED Talk a week and a half ago about this, and I have learned from these people several things, and I'll just be real quick about just a few of the things I'm learning from people. Number one, I think there's a big difference between the mask and the person. And after watching people who recover from really awful medical and psychiatric illnesses, and then if they go back into a toxic relationship, you'll see an illness come back. I'm starting to really realize how much we are a culture that depends on the masks that we see, but we're not our masks at all. I have realized that there's a dialectic between the mask and the person. And the mask, whether it's our degrees or our illness or how we look or our age, our masks reveal and conceal who we are. And I have come to believe that the last will be first and the first will be last, that things are never quite what they appear to be. I do believe that every person brings something magnificent into the world, and we suffer to the exact degree we don't get that. So, a couple of things. So I talked in my TED Talk a few weeks ago about a person who was diagnosed by biopsy with pancreatic cancer, the most awful kind. And then that was in 2008, and in 2013 she had an abdominal CT that showed the CT of the abdomen to be clean. And I also talked about a physician who was diagnosed by biopsy with idiopathic pulmonary fibrosis, which is also a death sentence. You don't get better from it. Your lungs turn to cardboard and you die. She went on disability, put her affairs in order, and now is with a chest CT that's completely clean. She's back to work as a physician, and she's so grateful for the illness that she does house visits for people who are too ill to get out of the house, because she views the illness as being the most profound gift she was ever given. So, what do these people tend to say about what got them better? That's kind of the big question, right? So there's a few things they tend to say over and over again. Many people tend to talk in part, they get rid of processed foods, they get rid of some of the chemicals, they make a lot of dietary and lifestyle changes. They talk about forgiving themselves, forgiving others, they talk about dealing with repressed feelings and issues from the past. But the thing they really want to talk about is the way in which they change their relationship with themselves. And this is a real hard area for us to get at in our culture because we tend to have such a big split between mind and body that we don't really know how to talk about this stuff or even see it. But Claire, the woman who recovered from pancreatic cancer, she said she realized at some point that if she was going to get better, she needed to, this is kind of an exact quote, she said, I realized I needed to not chase a cure, I needed to change my relationship with myself. That's very related to what Mary says. We're not our diagnosis. Our diagnosis is actually much more able to come and go than we realize. Our deeper experience and knowledge of who we are is a really big deal. Dr. Kane, who had the idiopathic pulmonary fibrosis, said that she never lost hope. And at some point in her journey, she realized that she needed to see and experience herself differently. So, what I've been learning from these people is that all of us, it's easy for us to think at some level have these quiet or not so quiet beliefs that maybe we're not good enough and that that's an issue, and we then set up all kinds of ways in our life that we can hide from that. I think what I'm learning is that we all bring something perfect and magnificent into the world, and we suffer when we don't realize that and when we doubt that. So what I have learned as a theologian about all of this is that we need theologies that are really built not on original sin, but the fact that we really are the image of God in the world, that we bring something perfect, whole, and complete in the world, and when we begin to see ourselves that way, all kinds of things really begin to heal and open up for us. And that, I'm not saying we cannot think ourselves into health. It's not that way. We cannot think ourselves into health. But when we really begin to get it and see the truth of who we are and see that we all bring something magnificent into the world and trust that, lots of things begin to open up for us. I think that it's easy to compare. We all walk down the street. We all can compare ourselves to others, whether we're wearing the mask of a patient or a doctor or a psychiatrist or lawmakers or whatever. And our masks are just masks. They're not who we really are. And I think one of the things I've come to believe is that it's really true that the last will be first, the first will be last. You gotta go down in order to go up. You got to die in order to live. I think that's the dialectic of life, and I think that it's easy to mistake appearances for reality. What I have also come to believe as a result of talking to all these people who get better when you think they wouldn't be able to, is that we need a science of health and not just a science of disease. We need a positive psychology. We need, I think it's a really positive step that our world is moving in the direction of less deficit-based ways of thinking, where we build models of peer-to-peer relationships, AA, NA, programs where people are helping people rather than experts, because as experts we often know less than we think we do, and patients are quick to realize that if they've got a little bit of experience. And I think the teaching in a theory of disease is that if you can take a person in a negative, difficult state back up to zero, that's progress. Well, yes, maybe, that's a first step. But what we're learning is that if you help a person create a vital, flourishing life that feeds body, mind, and soul at all levels, and that helps develop a flourishing life, that actually treats the disease a whole lot better than just trying to get a person to the absence of disease. And so I think I think we need a positive medicine, a positive psychiatry that's more rooted in what's right in people and helps people develop a flourishing, vital life. And if you're focused on getting a life, the disease tends to fall in place a whole lot better, and it's just not as much of an issue. Because I think we become what we focus on. So, as a result of all of this, listen to people, I've become very interested in helping to create a medicine of hope and possibility, because I think that doctors tend to be good at telling you what's realistic, but we're pretty awful at telling you what's possible. And I think we all need to know what's possible within us and to see the truth of who we are, because that's what kind of lights the fire in us. And so I think a medicine of hope and possibility is the future. I think we need it, and I think everyone deserves it. I think that's pretty much all I need to say, because I don't want to become the cure for insomnia for you tonight.